Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing in our discussion of supplements, and we want to talk about the different supplements that are out there that our patients are using, but also the supplements that our patients are using that may have an impact on dental treatment planning and dentistry in general. Well, our next supplement that we'll be talking about is chamomile, which I know a lot of you love because, heck, I like it too. It makes a great tea. Well, what is chamomile? Well, we do know that chamomile has been used for centuries as a carminative, the treatment of, let's say, upset stomach and flatulence. So it has been used as this carminative for GI ailments, but it's also used for things like skin and eye irritation, and even obviously insomnia, as many of you know. As a tea, it's very calming, and it can actually help you induce some sleep. So what's wrong with chamomile? Well, it does contain umbelliferone and other volatile oils that inhibit prostaglandins, which we know cause pain and inflammation, and leukotrienes, which also cause inflammation. Of course, you know there's different kinds of prostaglandins, but we're talking about the kind that cause pain and inflammation both in other body tissues and in the lungs. Well, if umbelliferone can inhibit prostaglandins and leukotrienes, then it must be great for treating inflammation. And therefore, maybe it is good for treating skin and eye irritations and maybe even inflammation of the GI. True, but there's also a dark side to chamomile, which is what? Well, sedation is certainly a side effect. And if you take other medications along with the chamomile that cause sedation, well, now you have additive sedation, which can be hazardous if you're driving a car, operating machinery, and so on. But also remember that chamomile is part of the ragweed family, which means that if you have seasonal rhinitis because you are allergic to ragweed, then consuming chamomile, both the flowers and the tea made from the flowers, can actually cause that allergic reaction in you. And so there are a few people I know who didn't know they had, seasonal rhinitis, had mild cases of it, but during the winter would get cases of this allergic reaction and say, but how can it be? Nothing's blooming out there. But they were pretty fond of their chamomile tea during the winter months to get a good night's sleep, and hence now you know how that happened. Well, we do know that chamomile has been used also in dentistry as a mouthwash to treat things like aphthous ulcers, and even it's even been employed to treat mucositis in patients who have cancer who receive chemotherapy. Well, was it effective in managing those particular oral lesions? Well, it had limited success, but it's still used as a mouth rinse to soothe ulcers and other irritations in the mouth. So there you have it, my friends. That's the story on chamomile. And again, this is Tom Viola with Pharmacology Declassified. Until next time, I sign off the way I always sign off. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.